So this is just a brief instructional video on how to use the bite block that's already preloaded onto an endotracheal tube. It looks about like this. It will come preloaded onto a probably 7.5 or 8.0 endotracheal tube. The whole idea is that these will be preloaded onto tubes so that anesthesia providers don't have to do anything as far as that goes. As far as the airway management part, it's pretty much the same as you would do normally. You intubate the patient regularly like that, and then pull the pilot balloon tubing taut as you slide the bite block down and wedge it in the corner of the patient's mouth between their upper and lower molars, with the elongated lip of the bite block facing laterally out from the corner of the patient's mouth. You just want to make sure that the pilot balloon is not kinked in any way as the bite block is slid down and wedged into place. The taping part, I just tape and go with a loop right underneath the lip of the bite block, and then tape around the endotracheal tube a couple of times, and then a final loop around the lip of the bite block, and then back down the side of the patient's face. And what that does is it secures the bite block to the endotracheal tube so that it's essentially one unit and prevents any slipping of the bite block into the back of the patient's oropharynx. And then everything is all secured to the patient's face as well, so you have a nice secure unit like that. Alternatively, you can secure the endotracheal tube with trach tape, and that procedure looks something like this. I take the trach tape, loop it through like that, and then the loop that I create, that loops underneath the lip of the bite block, which then holds the bite block secure to the endotracheal tube, and then the trach tape is tied to the patient so that everything is securely fastened to the patient, and then that loop of trach tape underneath the lip of the bite block prevents any slippage of the bite block back into the patient's oropharynx. So that's pretty much how it is. It's a quick, easy procedure. Once you've done it once or twice, it's really pretty straightforward. And then I'll have you fill out a survey just briefly afterwards about its use and so forth. So thanks for participating. I appreciate it.